Hey,
Keith started the recording.
Yes. Yeah, and I'll upload it to somewhere once it's done. And I'll share it with whomever.
3 cheers for you.
Thanks.
You can have an extra piece of pizza if we ever have lunches again.
I'm the sub guy. Come on. I can have an extra sub. Is that fair?
Why don't we get started with Janine?
Okay, on the 6/2/20 warrant, we paid Carl Collier for our rabies contractor for the month of April. We also purchased some bloodless hemoglobin testing supplies for the Pronto machine in Wick for $600. We purchased a new portable fridge freezer for transporting vaccines to the jail and other clinics. We paid for respite services for March, April, and May for a 0 to 2 client. We paid our regular providers for OT, PT, speech therapy for March, April, and May. And on the credit card for 5/29/20, we purchased supplies for some COVID patients that were in quarantine or isolation. And on 6/15/2020, we did pay the American Water Works Association $330 for a conference that Eileen O'Connor was going to attend in April in Saratoga Springs for the American Water Works. And it was canceled due to COVID-19, and they refunded us the $330. That's all I have. Anybody have any questions?
Janine, this is Elaine. I was just curious, the PT and OT and the services that you're paying for, is that in EI and 3 to 5? Or I guess I assume that none of that was happening at this point.
These are bills that were before COVID-19. These bills were basically happened in March and April, prior
Okay.
to.
Okay, pre-COVID.
Yeah, we haven't seen what's happened since COVID really started.
Okay, thanks.
You're welcome.
Are there any other questions for Janine? Would someone like to move to approve the claims?
I'll do that.
Second?
I'll second.
Any opposed? Okay. Thank you, Janine. Lori?
I can see her on there. We'll see if she can.
Yeah, I think she's muted, I think.
Mhm.
Her microphone is muted.
Oh yeah, she's got a little triangle there.
Well, Lori, if you can get on in a minute, great, but I'll start speaking a little bit to some of your program areas. We have been performing some teletherapy for preschool, which has been helpful. There's been a lot of guidance that's come out in the last few weeks about resuming face-to-face for preschool and early intervention. And we are reviewing all of that and sharing that with our providers because many of you may have seen that that was an exception made by the governor, was for preschool special education and summer school sessions. and the staff is busy. There were still all the CPSE meetings that went on, and preparing children for the fall, and if any of them were to be in summer session. Lori attended many of those via video conference or audio conference. And I think there'll be more to come. Certainly you'll see that we've had to continue to pay tuition rates for the school year. That was a mandate so that schools could remain functioning. And Lori's just texted me that she's spinning in her connection. So she's going to try to get on again, but I don't know if she'll be successful. So I guess I'll stop there with the highlights. I think it's going to be very interesting how things go as we review the criteria for resuming face-to-face therapies with families.
For kids whose services ended early and for kids who wouldn't typically continue services through the summer, is there going to be possibility of having catch-up sessions through the summer for those kids?
I really can't speak to that. I think the option was always given that children could have the video and the video conference ability or the audio with their therapists. And I think that they're probably, and I don't know the numbers offhand, I think we probably have more than typical number of children in summer program because of those reasons. But I can't say with certainty here.
Kathleen, you're still paying tuition and probably still getting whatever reimbursement you get. But the issue of busing, is that resolved, or that's just not an expense the health department will have to incur?
We have not been sent a bill for that, and we will have to address that when it happens. So that's where I leave it at that, because I think there's a question across the state. The bus companies certainly were concerned about that. And there have been some concerted effort on behalf of the bus companies to put their efforts together and make their position known. But we have not received a bill at this time. There's not a dial-in for Lori.
Anything else for the program for special needs?
And I'm sure Lori will be glad to update us a little bit more. And if you do have any particular questions, you can let me know. And I may not provide the level of detail that she can, but we can get those answers to you.
Okay, shall we move on to Eileen? Is Eileen still on?
Hi, yes, I'm on. So in your email, you received the consent orders that we've had recently. The first one is.
Hello.
Hello. Can you hear me?
Hi. Hello.
So this is Eileen. Can you hear me?
Yes, Eileen.
Okay.
I hear you.
So if everybody can put their microphones on mute, I think it helps. Okay. I hear myself.
I'm texting Lori to let her know.
Okay. Okay, so Gus's restaurant, during a regular inspection, there was a red letter violation and it was corrected, and this was their first unsatisfactory inspection, so no fine was charged against them, but they did sign a consent order understanding that it was a violation. The next one is with Wild Eats and Sweets, that they were operating without a permit. And they agreed to pay the $50 penalty and then got their permit. And then the last one is Mort's at Tinker's, where they also were operating without a permit, and they signed a consent order and paid a penalty. Any questions on those? So I will need motion.
I'll make that motion.
It's Beckman, I'll second.
I will second.
Okay.
Any opposed? Okay, we'll accept the motion.
All right, then I just wanted to give you an update on some of the things. We're getting a little bit back to normal here in environmental, if we ever were normal to begin with. Children's camps.
Well, I can anybody hear me? No, nobody can hear me.
I hear a distant voice from another planet.
Oh,
Is that Lori?
hi.
I just, she'll log off.
Okay, so pools and bathing beaches are opening back up. We have quite a few that have applied for a permit. Children's camps, there is no overnight children's camps this year. This is a state directive. We do have 2 children's camps that are going to open up this year, so we're getting ready with that. Campgrounds are back to normal, and they have been not entirely back to normal, but they've been operational since at least Memorial Day, where the seasonal and also the temporary campers could come and camp. The public areas in the campgrounds are still restricted somewhat. So that's kind of, the summer programs that we typically have. They're coming back up. We're really busy with septic plans getting submitted. So that's a good sign, I guess, for new construction as well as repairs. For harmful algal blooms, we've been moving forward, hoping that that won't be an issue this year, but we've already sent information to people who draw water from either Owasco, Skaneateles, or Cayuga Lake for their own private use, to let them know that if there's a harmful algal bloom, they shouldn't use it for any purpose. We've also asked the public water systems that get water from any of those lakes to update their emergency plans on what they're going to do if a do not drink order would be issued. We've been updating our website, and we're going to send out frequently asked questions to restaurants to let them know what they need to do in the event of a do not drink order, which is what we've done the past couple of years. We also have met with Auburn, Owasco, and Wells College to set up their monitoring, their visual monitoring of the raw water, and also sampling for the season. So we are moving forward. Also, I think I know a press release was issued. I think it was in last Sunday's paper, not this most recent Sunday, but I think the Sunday before that there was a press release reminding people about harmful algal blooms. So that's all I have to report today. We're very busy, and my staff is still continuing to do a lot of COVID tasks as well. Any questions for me?
Eileen, it's Brian. What's going on with Wells? Because they have the water system there for Aurora. Anything new on that?
Well, Wells, I believe they're trying to open, and probably Keith has more information than I do, but they did meet with us, not a real meeting, a meeting like this with me and Kathleen a couple weeks ago to talk about what their plan is to reopen and how they're going to bring the students in, and testing requirements, and if someone becomes sick, where they're going to isolate that student. So they are planning on moving forward. At this point, it appears that they are. I understand that they have reached out to some of their alums to try to raise some money, but I don't know whether they're really going to open or not. I know that the Village of Aurora has been in discussion with Wells College to create a plan on if Wells College does go out of business, then what's going to be the status? How is the Village of Aurora still going to get and some water. And I think at this point, it is planned that they would operate the water treatment system at Wells College. They're hoping to get funding for a new plant. That's their ideal. And there was a meeting last Friday with the village and some elected officials, and myself and Keith was there, and also the Water and Sewer Authority, to discuss, how, fundraising and, where the possible money could come from to build a new facility. Keith, do you want to add anything to that?
No, I think that was it was a very good summary. Thank you.
Okay. But so far, so good. They still have water flowing. That's the main thing.
Yes, they do.
Okay, very good. Thank you, Eileen. We'll move on to Kathleen.
So hello, everyone, and thanks for your patience as we navigate our technical issues. We'll try again next time. So speaking of which, I'll skip ahead. A lot of times we take a month off during the summer. I am requesting we do not do that given our current public health emergency situation. So we'll see if we can test drive our live stream a little bit more prior to our next Board of Health meeting. I think one of the things that all of our staff can speak to is, I guess I'll call it the COVID constant, as we are getting back into more typical program areas. We're doing that along with the continuous COVID-19 related work we need to do. And that encompasses everybody in the department and every one of the divisions you see here, because those who are non-clinicians are doing drive-bys, they're calling clients, they're scheduling things, they're navigating the paperwork, they're and it's 7 days a week, right? So we've set up a schedule to try and provide people some truly scheduled time off on the weekends to the extent we're able. Our nursing staff is probably the most limited because they have such specific skills that we need in interacting with our clients who are both in isolation or in quarantine or providing our contact tracing. So their time off is a little bit more limited. So they might be more of an every other weekend, but Nancy can speak to that a little bit better than I am right now. So it's something we're continuously working with while we introduce ourselves back into some of our programs that we need to do. Right? It's not just the things we like doing, it's the things that are required is where we're at right now. So that's a lot of our environmental programs, it's our preschool, it's our EI, it's our ongoing communicable disease control and maternal child health, and as we enter immunization time as well, for where it really hops up in regard to school. We continue to get a lot of guidance and recommendations from the state regarding COVID-19 and the phased reopenings. And I think that's where we're spending a lot of time, is in helping people and businesses interpret this guidance, as well as fielding complaints and concerns that come to us. We are a little frustrated in some situations with complaints and concerns that come our way. And so we are facilitating a conversation where I expect within the next week we'll have a more firm plan as to how, as a county, we wish to move forward with the consequences for some of the repeat offenders. So, for example, when it comes to food service related, if we get repeated issues, that's a slam dunk. The health department will, give them a violation, and we'll move forward in our routine process that way. But we get complaints from grocery stores and hardware stores and other businesses. So that's something that we need to have a consistent approach, and are in the process of developing that. We just got a letter today. We're still in the process of trying to finalize our Article 28, which are diagnostic and treatment clinic adjustments that were required by the State Department of Health, having our clinic here on site at 8 Dill Street. So they acknowledge that they received our plan that was signed off and attested to by the architect. And they are going through their approval process before we can do our final step as far as a little bit of renovation that's required. And they're also giving themselves a little bit more time to respond to that due to the COVID epidemic. So we'll keep you apprised on where we are at in that regard. And I guess just on a more interesting note, we know there's, people are frustrated. They want to get back to normal, and that's not going to happen, right? It's not going to be the same as it was, but there's just behavior modifications we can do that are not unreasonable, such as face coverings and what we call social distancing. And one of Nancy's staff members said she was at a gathering talking to a person who had been either in isolation or quarantine, and said, I think we need to put a different spin and not call it social distancing, but call it safe spacing. It's just that kinder approach, right? So maybe that will put people in a different frame of mind when they think that way. Super busy, right? Summertime, super busy anyways, but we still keep moving forward. So if you have any questions, we're here.
I was going to make a comment instead of social distancing, physical distancing, because that's really what it is.
Right.
Or smart distancing. There's more than one ways there, intelligent distancing. Kathleen, I've got a question. I've noticed, and I couldn't agree more, that people are just want to get back to normal. But I've noticed there seems to be a lot of attitude amongst the general public, certainly amongst some people that I've spoken to, that because we are in the phased opening stages, it's almost as though the governor, the government has given me a pass to go ahead and kind of go back to the way things were. There seems to be, at least amongst some people, a lack of awareness that, things are not really haven't changed. We've just moved on to a new phase. And I'm just curious, how much do you think the health department needs to really kind of give that message that we are trying to get back to the way things were, but everyone needs to be aware that the epidemic or the pandemic is still out there?
I think it is important that as a public health department, we continue to reinforce the messaging. People are weary, right? And what do they call it? Like news fatigue or whatever, and are tired of hearing the same thing. And that's where it becomes our behavior modification, right? It has to become our new normal. And I think, unfortunately, some things that are a common sense public health approach tend to become politicized, and they shouldn't be. So we're going to keep, holding the line. And as far as what our public health guidance and science is telling us, and we will have to find ways probably to reinvigorate the message so that it's heard again, right? We are, as a department, looking to scale back on our daily updates and become a couple times a week, unless there's something truly unusual that occurs, such as a significant outbreak or a death or something unusual. So we'll be starting to phase that in. And so hopefully people will then hear the messaging a little better when it comes out, because they won't be seeing it every day. But we're trying. And if you guys, again, we're always open to ideas. Sometimes it's a funny approach. Sometimes it's a serious approach. So, but there's all sorts of ways that can be done. And I can't quite hear that, read that, Cassie, but
it says the end of stay-at-home order doesn't mean the pandemic is over. It means they currently have room for you in the ICU.
Yeah. Well, and so that's where I think we have to be cognizant of the fact that, there are COVID. I don't necessarily think there's been our first wave through yet. When we look at, and this is my opinion, when we look at the Southwest, when we look at the Southeast, we are seeing tremendous increases of positive cases. We are seeing the ICUs get jammed up. So this is definitely not a done deal, right? So we have to learn until there's the vaccine, until there's the better treatments, we have to do our smart distancing, our physical distancing, and keep being considerate of each other and our health.
In one of the pediatric things, it talks about children using zombie arms so they stay away from one another.
It's a good idea.
Good messaging. Thank you, Kathleen. All righty. Nancy, should we move on to Nancy?
Good afternoon. Thank you for that nice lead-in, Kathleen. It has been and will continue to be one conversation at a time. It is all day long and into the night because persons will call because in their world, it's urgent. So we certainly want to take those calls. We want to try to provide information in a very timely manner and conversation. So that will continue. There are moments, there are hours, it gets a little discouraging. But we need to support one another and we need to continue on. We've had one positive case since Friday. So that is good. We have a total of 112 cases, and I know you look at that data. So of recent, including that case since Friday over the weekend, it was the second case from the apple farm in Oswego County that it's got some press because of the outbreak at that apple processing plant. We want to keep our eye on that. Again, when they cohabitate, as we've seen in Madison, as we've seen in other areas, we want to get a lead on that. And already a month ago, had a conversation with the CEO of Turk's Farms in King Ferry, because that's a big operation, and migrants come up in August 1st. Had some persons coming, small number, less than 10, I think, come in before that. And anyways, environmental works with them every year. And so we collaborated with environmental, and we found that owner to be very receptive and trying to plan a month ago. Just wanted him to get some ideas of what he should consider. So Turks needs to submit a plan to environmental by the end of this month, and then we'll be engaged further with Turk's Farms. We also have the onion farms to consider that's up in the northern part of the county. So that's one focus of our attention. We, of those cases, just some interesting little facts, the average age of our 112 cases is 39.5, with the age range between 3 months and 100 years old. So we've had 2 deaths, and we've had, of that 112, 47% are male and 53% are women. At this time, we, as you may recall, collaborated with the hospital to create a respiratory clinic. And that is going to go on pause at the end of this week with always, as we will adjust and have to remain agile to adjust whatever is out there. So right now that's going on pause, and then what future need there be, it will potentially go up again. We'd like to avoid that, but we'll see if that happens, it will. Right now, the places that would be able to accommodate those cases would be obviously primary care, the primary care person, as well as the urgent cares in East Hill. We've also, taking it out for a spin this week, is we've reduced the swabbing clinic to once a week. We found in the last couple weeks, the numbers, we ran 2 clinics a week, and 1 clinic, there wasn't sufficient use of it, and we have to monitor that along with how much PPE we're using. So we thought we'll take it out for a spin, and we'll just add on another half hour to the existing Tuesday clinic, put it in the morning, which seemed to be a popular time, see how it goes. Nothing permanent, but let's see, and it has been successful. So we'll do that for the next week or so. We'll see how that goes. There are 6.5 FTE RNs in the department, and that includes myself. So we have one of those FTEs just went out for maternity leave and had delivered a beautiful baby boy at the end of May. We have a second FTE that has provided 38 years of service to the health department and is retiring July 11th. So kudos to Dorothy. 2 RNs from the Office of Aging is providing us and has provided us some hours throughout the week to augment staffing here, which has been very appreciated. And along with all the other colleagues in the department, that it's as I mentioned at the last meeting, it's a unified effort for sure. Colleague Kevin, has provided, oh, that's the hospital. Maybe they want to go up with the clinic again. I don't know. Okay. Colleague Kevin has provided county departments, nearly all in the Cobb, probation, mental health, 911, and career center, with professional guidance for establishing workflows, the use of PPE, the management of visitors, and infection control practices. He created and provided a PowerPoint to the Chamber of Commerce and various departments in the county government, which has been received well, I'm glad to say. Kevin and I engaged with Auburn School Administration and presented a program there last week, the week before, I don't know, days run into one another. And we've had a conversation with the Southern Cayuga school system. Tomorrow, Kevin will interface with the community college. So we will offer those kind of services to, we offer it up in conversations, we offer it up to all businesses, anybody that wants some kind of interaction with their staff and so forth. As you well know, many times they'll listen to somebody else besides their supervisor. So we continue to do that. In addition to, we've also done some articles in the newspaper, and I know it's been put online too, in relation to what was stated earlier about keeping up and keep educating the public as we unfold. So I know there's been one done on masking. I know I should recall these off the top of my head, and I should have been better prepared, I guess, for that question. But there has been things, because we've recognized that need as well, as to continue to educate and the public, though I think much of it needs to be in conversation as well. And that's with every conversation, we're trying to enlist them as another ambassador to help spread the message, because conversation many times can influence not only them, but us too. So we benefited from those conversations. We are continuing on with lead, and now we're seeing actually with the reopening of well visits and so forth, we're seeing more results coming in. Just to recap, since last October 2019, when they changed much about the lead program, as you may recall, and reduced the level to 5 that we were going to monitor and so forth. We've had 141 children test 5 or greater for lead. And 47 of that 141 were greater than 10. So we've monitored 55 cases since January 1st, and currently we have 15 cases. And we expect we'll see an uptick in that when visits are now being had, and more to come on that, I'm sure. That is my report. Any questions or concerns? Please share.
Nancy, I just wondered, did you guys ever add the additional lead staff that was grant funded, or at some point you got funding to add some lead staff to try to mitigate the impact of that? Were you ever able to do that?
Boy, that's a good question. Kathleen,
So, yes, we have a sanitarian who was hired to help in that.
yeah, okay, Kendra.
Yes.
Yes. And Kendra has been helping us out with COVID.
Is there anything that we would do as a local health department for surveillance in the fall? Besides the usual the testing once a week that you guys are doing, are we thinking that we would do any sort of local surveillance?
I can speak to the wastewater study. So you probably read in the paper maybe 2 months ago that Onondaga County was working with SUNY ESF and SU in collecting samples from their wastewater, and the labs at those universities would analyze it to see if there was any evidence of the virus. And so Seth Jensen heard about it from the city, and so he got in touch with me, and he agreed to have his staff pick up wastewater samples. And so they've been doing it for about 3 weeks or 4 weeks now. And he picks up a sample at the wastewater treatment plant itself, and then at 3 other locations within the distribution system or the collection system. We call it a sewer shed. And then I've been giving information to SUNY ESF and SU on where the positives, which sewer shed the positive COVID cases live within. So I don't give them the address or anything, but I just said, yes, they're living in the North Interceptor or the South Interceptor sewer shed, and on the date that it was determined to be positive. So they're trying to correlate between what they're seeing in the wastewater with the positives that we're getting. And hopefully, so far the activity has been low. They do see some presence of the virus, but it's been very low. We've just been doing it for the past, I don't know, month, maybe a little bit more. But we're hopeful that this can be an early warning sign in the future. So more to come on that.
Elaine, if I may ask, how sensitive is that testing? Are you guys able to sort of connect the dots in the sense that you know where there's a positive case and you're seeing that you can measure the virus in that particular sewer sector?
That I don't know. I don't know yet. We're hoping to set up a meeting next week to talk about, okay, what are they seeing in the sewer systems and what data have I given them in terms of the positives to see if there's a correlation. But in terms of the lab analysis, I am not familiar with this analysis, but it is something that's being used in a number of other communities as well. I think Tompkins County is participating in a study, and Onondaga County. And so they're trying to spread out. And this is actually all free for us. They're not charging us for any of the work. And Auburn, the city, is graciously picking up the samples and driving them to Syracuse, so they're providing the labor on that.
Eileen, if all of a sudden the presence of the virus spikes up in a certain area, what do you propose to do with that information? Make a public, disclosure? I mean, what happens if there seems to be evidence that it's increasing?
Well, I think if there is evidence, and this, of course, we'd probably sit down as a team with Kathleen and the public information people, but we would probably put the word out. Yes, there is evidence that it's in the community. People shed the virus, of course, as we know, when they don't show symptoms. And so we would put out information to say, please, use your physical distancing and your face covering and redouble your efforts on doing what we know can help, limit the transmission of the disease.
And I guess, obviously, the utility of this as a tool is really limited to areas that are served by the sewer district, right?
Correct. I mean, we could expand it at some point to include like Weedsport, Port Byron, and Moravia and Fairhaven. Those are the other communities that we have. But I think for the most part, it's getting close to half, a little bit less than half of the residents, because it picks up most of Owasco, most of Fleming, Senate, Aurelius, so the donut towns, as well as Auburn. So it is picking up a lot. And like I said, we could extend it to other areas. I just don't think they have the staffing to collect the samples and drive them into Syracuse at this time.
Okay, thank you. Thank you so much for updating us on that. I guess anything else for Eileen? If not, let's move on to Dr. Joya.
This big thing is being vigilant for new cases and trying to track them down. I would recommend if you had a positive sewage samples, trying to let people know where the area might be a higher risk, and then trying to focus on recruiting people for coronavirus testing in those areas. Be helpful, and then you can do contact tracing, based, once you get to people and the social interactions. The only scary parts, I guess, is the contract tracing stuff's not been going real well in New York City with a lot of people. We're only be able to track down about 30% of people. We probably could do better here just because there's smaller groups and people are perhaps a little friendlier. But hopefully we don't have to worry about that. But it has been a problem downstate and other states. They're having trouble with the contact tracing. And in the United States, we're not too willing to give up our privacy. So other countries have been using technology, but a lot of that stuff is invasive in privacy, and doesn't look like probably our culture is ready for that yet. But we'll have to see. If it gets really bad, people might need to be more careful and give up some privacy rights. But hopefully, you won't have to worry about it. But we'll see.
Okay, well, thank you.
Dr. Gossipov,
Yep.
could we go on record, since we're recording again now, to approve the minutes again?
Sure. Do we have would anybody like to move to approve the minutes from May 19th?
Yeah, this is Batman. I'll move it again.
Thank you. Do we have a second?
I will second.
Any opposed? All in favor? Aye. Okay, we'll accept the minutes from May 19th. Thank you. Is there anything else we need to do procedurally before we ask for a motion to adjourn?
I don't think so.
Very good. I'll ask for that motion then, unless there's something else.
I'll make the motion, Daly.
Thank you. Second.
Archer.
Very good then. Thank you, and we'll meet next month.
Thanks,
Thank you,
everybody.
everybody.
Bye, everyone.
Bye-bye.
Bye.
I'll shoot Keith an email and ask him